Hey guys, Dr. Davin, board certified dermatologist. Today we'll be talking about three simple, easy ways to treat acne effectively and efficiently. So it's not a big list, 3 methods only. Truthfully, this is going to cost you about $10 a month, right? Now, if you miss some of the product recommendations, it's in the link below. Now, what I'm trying to do is give you a cost-effective way. In other words, not a big product sell, and basically just 3 really simple ingredients. First thing we're going to start off with a cleanser. Why is it important? Because cleaning your face can reduce the amount of buildup of both dead skin cells, but also bacteria. Now, the cleanser of choice, which I pick, is basically salicylic acid. Why do you say salicylic acid over something like benzoyl peroxide? It's this, because salicylic acid is gentler on your skin, especially if you're using a 2% formulation. So you can use that in the morning. What I suggest you start it off just once a day. If you try to use it more than once a day, you'll probably get some skin irritation. So why salicylic acid over something like benzoyl peroxide? So first of all, it's anti-inflammatory. So benzoyl peroxide, what it does is dries out your skin. It doesn't reduce inflammation as much as salicylic acid. In the scheme of things, salicylic acid is also cost effective. Benzoyl peroxide, yes, you can buy stuff like Benzac AC. It's cheaper than something like Proactive. But something like a salicylic acid cleanser from Neutrogena or something like Paula's Choice, or even, believe it or not, Cerave's got one. So it's going to cost you between $8 to $14 to buy. That should last you at least, if you're using it once a day, that should last you at least something like 40 to 50 days. So in the scheme of things, you're paying only a couple of cents a day for that cleanser. So first thing is a cleanser. The second, what do I recommend? Skip your, yes, your retinols, your retinaldehydes, we know all that. Your retinol palmitates from many different companies. You're paying for the branding and you're paying for the packaging. So what I suggest, go for the actual prescription retinoids if you can. So in the US and in some countries in the Europe, you can get something called Differin, which is adapalene, which is a medically prescribed retinoid. So retinoids don't need to undergo conversion to retinoic acid compared to something like retinol or retinaldehyde or retinol palmitate. So when we're talking about things like adapalene, which is Differin, you can buy it over the counter, from what I remember in the US, 0.1%. In Australia, it's prescription, even for the 0.1, and we can go up to 0.3%. So my suggestion, start off 0.1%. The trick with using a retinoid is to actually apply it on acne-prone areas. The biggest mistakes we see as dermatologists is patients using it as spot treatments. The whole idea is to prevent acne from forming in the first place, and that's how retinoids work. They reduce your oil production. They help with your differentiation of your cells, which means your blackheads are less. They reduce basically oil production as well, and they also reduce the bacteria which cause acne, which is basically C. acnes. It doesn't really cause acne, but it's implicated in acne. It can be a hypersensitivity to the bacteria. As a result, you can cause inflammation. So those are the 4 ways retinoids can help. Now, in the context of retinoids, you need to use it properly. So the first thing you got to do is you got to find out what your skin can tolerate. Everyone's skin has a different skin threshold. Once you exceed that threshold, bad things happen, like irritation. So what you might want to do, put it to acne-prone areas. So for example, if you have hormonal acne, it may be around the jawline area. If you have normal teenage acne, it'll be around the T-zone, so your forehead, your nose, your chin or cheek area. So what you need to do is you need to actually use it sparingly. So what you might want to do is start every second day, something like Monday, Wednesday, Friday nights. Use it at night because it can be photosensitive in the morning. So apply a small amount to that area 3 times a week. If you have no redness, burning, stinging, irritation, or scaling, what you could do is you can increase it by 1 or 2 nights per week. If you do have any irritation, all you need to do is back off that, okay? So we talked about the use of a salicylic acid wash. We talked about a retinoid. What's the third? Believe it or not, the third is just a simple moisturizer. Don't complicate things. Guys, I'm not here to give you a whole lecture on the use of, for example, zinc or niacinamide or ascorbic acid or tea tree oil or witch hazel or any of that. I'm trying to keep it simple because I'll tell you why. Why do I choose a moisturizer as my third ingredient, even over sunscreen? I mean, sunscreen, that's another issue, yeah? So, in the context of a moisturizer, the reason why I actually choose that over anything else is this. Your salicylic acid can be irritating. It's less irritating than benzoyl peroxide. But combined with things like a retinoid, it can actually cause more skin irritation. So what we want to do, in acne itself, the condition itself is a defect in the skin barrier. Yeah, so when you have little dots, pimples, zits, pustules, anything which you may pick or scratch, you basically have an impairment of your barrier function. And it's very important to actually establish barrier function, because if you don't, things like salicylic acid can be more irritating, as well as your retinoids. So it's very important. A really good moisturizer. What's a really good moisturizer? Most often it's a very cheap moisturizer. Believe it or not, a lot of dermatologists like Cetaphil. If you like Cerave, go for that. If you like, a bland, cheap moisturizer, hyaluronic acid from The Ordinary or the InKey list, or any one of those big brands, they make really cheap, cost-effective moisturizers. So all in all, you're basically using a wash in the morning. You're going to moisturize as needed during the day. You're going to use your retinoid at night, and then you're going to moisturize thereafter. Really, really easy. Look, in most situations, those those three hints will give you a good improvement. It does take anywhere between 4 to 8 weeks for that to happen. So how are you going to gauge improvement? You've got to gauge it. You can't gauge it subjectively. You can't go, well, I feel like things are better. Do what most dermatologists do. You take photos and you can count your lesions. For example, you may have like 20 pimples, for example, at baseline. And then you retake the photos in 6 weeks' time after this routine or regime, and you count your pimples, and you may have like 5. So you know that's actually working. So remember, where things go wrong is this. Number one, you only use it to zits. So you're applying it as a spot treatment. That's wrong. So there's certain things for spot treatments, things like higher concentration salicylic acids, benzoyl peroxide, hydrocolloid dressings, topical erythromycin and Zinarate and clindamycin. It's a whole heap of different stuff for topical treatments in regards to spot treatments. But today I'm teaching you how to reduce overall acne, how to prevent it. Obviously, all the other adjunctive things are very important. For example, eating healthy, drinking lots of water, taking off your makeup, and a whole heap more. Guys, there's a lot of little hints and tricks down below in the link below. Hope you liked that video. It's a very, very simple one. But this is what, if you see a dermatologist, most of them would actually, if you've never had treatment before, they'll start you on something like this. Really cheap, really simple. We're not here to complicate your whole skincare. We're here to simplify it. If you want to know a whole heap more, remember, there's a whole heap more, right? So do not confuse yourself with a whole heap of different products, because sooner or later you're going to get some skin irritation. You'll go backwards. So if you're going to start layering your 10-step Korean regime with your cleanser, toner, your witch hazel, your tea tree oil, your zinc, the whole lot out there, it's going to be bad. So keep things simple. Guys, I hope you liked that video. One new video every week. And please, by all means, comment, like, subscribe, share. Chime your thoughts on what you think is good for your skin and your experience. I'll catch you next week. Bye for now.